The United States Embassy in Nairobi is reassuring Kenyans that their health data will remain safe and unidentifiable under the new 5-year health cooperation framework signed on Thursday in Washington, D.C. between Kenya and the United States. According to the embassy, the framework is designed to support Kenya's priority health programs while strengthening the long-term sustainability of the country's health systems. And as Emily Chebet reports, the agreement also requires the Kenyan government to increase its domestic health expenditure by $850 million over the 5-year period.
Kenya is the first African country to sign a government-to-government health agreement with the United States of America. The $2.9 billion framework will see the U.S. government invest 208 billion Kenya shillings directly into Kenya's health institutions in the next 5 years. The U.S. Embassy in Kenya has dismissed claims of data sharing with the U.S. and unauthorized specimen collection, saying strict safeguards are in place.
Any data sharing going forward will be aggregated data, in other words, not personally identifiable data, and it'll be aggregate data so that we can collect information like the 1.3 million of people who are on antiretroviral treatment. So there's no individual identifying data.
We would test some of the specimens where they didn't have the capabilities within their own labs, so that we would actually continue with that moving forward. Also, part of the agreement is building up their lab networks so that they have those capabilities themselves. And so we will be continuing to work with that. It's not really a change of what we've done before, but it's really kind of recognizing how we've worked together.
The U.S. Embassy says the money is not a loan, but direct government-to-government assistance aimed at strengthening Kenya's health system and reducing reliance on fragmented donor-led programs.
There's a lot of questions about, should we be getting assistance? Kenya should be self-reliant. What about our sovereignty and our rights? And I think that this is really an investment in Kenya's sovereignty and self-reliance, and a move away from an assistance-dependent country, right? We would love to see a Kenya that is not receiving assistance, but perhaps working to assist in other countries.
It will be a transition, a phased transition over time to try to get to make sure that the government has the systems to be able to do this, and that we have the oversight mechanisms in place to ensure that as what was said with President Ruto, every dollar and every shilling is spent correctly. And that's both U.S. government dollars and Kenyan government shillings.
According to the agreement, Kenya must incrementally raise national and county health budgets over the 5-year period from 10 billion Kenya shillings in 2026-2027 to 50 billion Kenya shillings in 2029-2030. Procurement of health commodities will shift gradually from the U.S. government to the government of Kenya during the 5-year period. Frontline health workers funded by the U.S. will be mapped and transitioned onto the Kenyan government payroll. On top of that, Kenya can earn over $100 million in performance incentives if it improves key health outcomes according to the framework. Emily Chebet, Citizen TV.
Now, the